I'm Dr. Ashesh Jani. I'm a Winship radiation oncologist. I'm a professor at Emory, and I'm principal investigator with Dr. David Schuster in nuclear medicine on a new imaging study for recurrent prostate cancer. This is a brand new imaging study that allows us to pinpoint, to target where the source of the PSA is in gentlemen who have had PSA rise after surgery. Tens of thousands or even hundreds of thousands could be affected because prostate cancer, after initial surgery, approximately 25 to 30% of patients will have a PSA failure. Radiation is the standard treatment that's given, and this is an opportunity to help fine-tune the decision to give the radiation. The gentleman will have standard imaging. They'll have a bone scan, they'll have a standard CAT scan or MRI scan. Those are all standard imaging tests that we do to try to make sure that we can reach the areas we need to reach with the radiation. In this particular study, it is randomized, so one group is going to be getting standard imaging. The other group has one additional stop in nuclear medicine. The scan is completely paid for by the grant, and they basically have a 50% opportunity of getting this new imaging study that can help us see where the source of the PSA is. When the study is done, we're actually able to bring it into the radiation treatment planning process and help to fine-tune the decision to give the radiation and to sculpt the radiation planning process. This is an area where the standard imaging is really shooting in the dark, so I think a lot of patients have been very excited to be on a study where we are able to have a novel way of being able to pinpoint where the source of the PSA is. Those gentlemen that have been randomized and enrolled on the imaging arm have given us very good feedback. It's a very simple test. It's basically one additional stop in nuclear medicine. It's very similar to getting a bone scan. So it adds very little in the way of inconvenience in terms of participating in the study. In roughly 30% of patients, there's been a significant change in decision in whether to treat with radiation or the general style of radiation to give. And in roughly 3/4 of gentlemen that were treated with radiation, there was a significant change in the area that was treated. And furthermore, we found that giving treatment using this new technique that's allowed us to pinpoint to where we need to give the radiation, that we haven't added anything significant in the way of toxicity to the patients as well. So we're very excited about these initial findings.